Thanks for staying with us. Another large group of Wisconsin workers are now eligible for the COVID vaccine.
Right now, health officials say if you are a chef, server, or host in a restaurant, you are immediately eligible for the COVID vaccine in Wisconsin. DHS says they added that group due to the increased supply of vaccine and because of the role of restaurant workers.
And perhaps you even Googled how to calculate your body mass index in the past 24 hours. Wisconsin announcing yesterday it would use BMI as one of 20 new factors for the next round of eligibility.
Anyone 16 and older with a BMI of 25 or higher will be eligible for a vaccine on March 29th. Amanda Quintana is at the Alliant Energy Center with why that measurement is being included. Amanda?
Yes, well, the state estimates about 2 million people are going to become eligible in the next 17 days. That's 17 days from now. A lot of those people, conditions such as cancer, asthma, and Down syndrome. It also includes people who are overweight or obese, but it's how you measure that can make a lot of people eligible all at once.
It's really tricky when you start getting into say, well, this condition warrants, being eligible and this one doesn't, because within any single group, there's going to be a huge variability of the people within that group.
Just like there are varying degrees of asthma or diabetes, there are varying degrees of being overweight. Someone with a BMI of 25 can look thin and healthy.
The Green Bay Packers are probably all eligible in the current 1C group because, muscle mass does obviously contribute, and you can have BMIs that are elevated, people who may not have all of those same levels of risk.
A high BMI is on the eligibility list because it does contribute to a worse reaction to the virus. Dr. Matt Anderson says it's simply harder for the body to fight back.
The lung function just isn't as good. Again, more typical in those higher BMI scenarios than in the lower ones, but it really is about the underlying health condition of the individual, and those people are at more risk for lots of things.
There are multiple studies from the CDC showing this, saying obesity may triple the risk of hospitalization, and as your BMI increases, so does your risk of death from COVID. But having a muscular athlete eligible the same day as someone with cancer, well, that leaves it up to vaccinators to prioritize who gets a shot first. DHS has given some ideas on how.
Perhaps prioritizing individuals with 2 or 3 high-risk conditions, or maybe start with younger adults who are 50 to 64 with 1 high-risk condition, then you go to the younger age group.
But SSM Health and UW Health haven't decided how they'll do it yet. Dr. Anderson says identifying who these eligible patients are is the first challenge.
We're going to depend on them to help us identify who they are.
Then who is in line in front of who? All of that on an honor system, well, there's no perfect process for that.
And the reality is it's going to be very gray and messy within that.
Some big systems like SSM Health and UW Health, they do have data on their patients, but they say that is not perfect. Now, smaller pharmacies and public health here at the Alliant Energy Center, they don't have that data. So they really are just trusting the people who come up, who say that they are eligible for the vaccine. Now, Dr. Anderson says if you are young and you are healthy, but you are still eligible, he's saying have some patience, maybe wait a little, and let people who are more at risk get the vaccine first.